Governors signed two new bills today aimed at supporting Floridians who are dealing with mental health crises and substance abuse.
Yeah, it's a topic I've covered extensively since the pandemic, and I will continue to highlight the resources and programs available to Floridians. Clara Reynolds, the president and CEO of the Crisis Center of Tampa Bay, was in the room during today's announcement and bill signing, and then she stopped by our studios to talk to me about what these two bills mean. Let's first explain what the two bills are meant for.
So Senate Bill 1620 is the recommendations that came from the Commission on Mental Health and Substance Use Disorder that was established back in 2022 in an effort to really look at the behavioral health system of care across the state of Florida. And so there are, I believe, about 15 or 16 commissioners. They work with subject matter experts and have made recommendations that are now codified into law. One of the biggest ones, in my opinion, is the creation of a data repository. Right now, behavioral health records live in a variety of different systems that don't talk to each other. So an individual may start off with having a behavioral health diagnosis, maybe in the school system, but they may not, that information may not transfer if the individual goes into child welfare or juvenile justice. So this repository, when it is finally completed, will allow those individuals with the appropriate credentials to be able to access somebody's records across multiple systems.
Now there is another bill, right?
Is. Senate Bill 168, it has become known as the Tristan Murphy Act. And the crux of this one is to really provide comprehensive behavioral health interventions when an individual first enters the criminal justice system. So this is really for adults that maybe have an offense, and either the family, friends, somebody recognizes that there's a behavioral health need. It requires some initial assessment and treatment for that individual. So this would really provide those individuals that are struggling with a pretty significant mental health diagnosis, making sure that they get the treatment and services they need while they're also serving out whatever that sanction is that is appropriate to what has transpired.
So how are these bills helping the Crisis Center of Tampa Bay?
I would say that a part of this is the entry point into the system. So when somebody is in crisis, we are very honored again to be the provider for that crisis and suicide hotline. That's 988. And we're very proud of the fact that we have the highest call answer rate in the state. And as the governor said today, when somebody calls 988, 96% of the time, no additional intervention is needed. So it is highly effective, it is cost effective, and it really does help our communities. What this will allow us to be able to do, though, with both of these acts is be able to offer those callers who are in crisis additional help and support.
By the way, Clara was one of the commissioners who helped make recommendations for Senate Bill 1620.
Making progress.